This open meeting of the Grafton Board of Health, I'm sorry, I'm in the wrong section. Good evening and welcome to the August 5th, 2024 Grafton Board of Health meeting. As a preliminary matter, this is Jennifer Maynard, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn here.
Karen Gostowski-Galvin.
Karen Gostowski-Galvin here.
Bill Mueller.
Yeah.
He was here.
Yeah.
Where'd Bill go? All right, I'm going to keep going. Hopefully Bill joins us again. Staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Nancy is not here today. Beth Coltrera.
Here.
Thank you. Amelia Houghton.
Here.
Ian Wong.
Here.
Devon Thornton.
Here.
Cherry Tangri.
Here.
Thank you. I would like to open the meeting. Can I get a motion to open the meeting?
Yep, this is Dan Finn. I'd like to make a motion to open this meeting.
This is Karen Gostowski-Galvin. I'll make a second to that motion.
Roll call.
Dan Finn, aye.
Karen Gostowski-Galvin, aye.
Jen Maynard, aye. Okay, just a couple of more pieces that we have to read where we're remote, and then we'll jump into our agenda for the evening. Second. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extended certain COVID-19 measures adopted during the state of emergency. This act includes an extension until March 31st, 2025 of the remote meeting provisions of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of COVID-19 virus, the Act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening, although we do have some guests. So we will utilize question and answer feature, but we will also call on individuals and ask that you indicate your full name and address when submitting comments. For this meeting, Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that take care not to share your screen on your computer. Anything that you broadcast may be captured by the recording. Any supporting materials that have been provided to the members of this body are available in the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first item on the agenda, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I will introduce any speakers on the agenda for a topic. After they conclude their remarks, I will invite the board members to provide any comment, questions, or motions. Please identify yourself by name when speaking. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until I yield the floor to you and state your name before speaking. If members wish to engage with others, please do so through me, taking care to identify yourself. Finally, any votes on any motions made during this meeting will be conducted by roll call vote. Okay. I feel like that gets longer and longer every time I read it, Karen. All right. As I said, we do have some visitors with us today. So we wanted to take a moment before we get into the other agenda items, just in the essence of other folks' time to hear from folks. And Mr. and Mr. Patel, I don't know which one of you want to start your comments. I know that our understanding is that you're here to request the board consider not doing the 3-day suspension from your tobacco violation at 87 Worcester Street.
Yes, that is correct. So yes, there were a few concerns brought up. I think Sherry told us that because we weren't able to file the paperwork correctly in time, and then there was our very first inspection, we did get a violation. However, so the reason I can explain for not being able to file like the paperwork to get the tobacco permit from the town in time is because our group has taken over a few locations in Massachusetts, and because of the different types of paperwork that we have to file town by town, I was able to acquire a business certificate from Grafton. However, some of the information that I needed to get the tobacco permit from the town was like workers' comp insurance information, which we hadn't gotten in yet. So that's why the paperwork wasn't filed on time. And then secondly, the violation. So the violation was given out at a time where the employee that was supposed to be there actually wasn't. He made a bank run, which because it's like right next to us, the Uni Bank, and he was making a bank run, and he allowed his cousin to work there for like I don't know, maybe 10, 20 minutes while he was making the bank run. So the person that was actually supposed to be in charge, like taking customers at that time, wasn't at the location, and that's probably why there was an underage person served at that time.
Just for the record, can you state your first name for
Oh,
us?
yes, I'm sorry. My name is Rushank Patel.
Thank you, Rushank. Any other additions from the other party?
No, I'm just part of the business LLC as well. So that's why the Rushank and my name is Ankit Kumar B. Patel, and I'm the part of the ownership as well. So yeah, whatever the concern Rushank mentioned it, yeah, that was the right,
Thank you.
All right, you're welcome.
So I do have a follow-up question, and then I'd love to open it up to the board members and, certainly Cherry being the expert on this. I guess my question would be, when certainly I'm sure these instances happen where the person that is properly trained throughout stores needs to step away. Is there a reason why in that instance, the person that was left there was not instructed to not complete sales that they were not authorized to complete? Or trained?
So to the best of my knowledge, the person that was there at the time was like brand new to actually that store, and I'm sure that they weren't aware of like even checking identification. We just acquired these locations, and we've been inputting like the ID scanner systems into our like new locations one by one. However, I guess we just hadn't gotten to that location because so most of my stores you have to scan the person's ID, and then it allows you to continue the sale. But because we took these over from Global Montello Group, and there I think the system that they had, there's some way to override that, I guess. And so the person took the customer without like confirming the proof of identification.
Sure. So just a follow-up question to that.
Yeah.
I
Yes.
guess if, for example, in
Yeah.
another store that you had not newly acquired,
Yeah.
if they had, all the proper equipment,
Right.
it was new, and they were being trained, for example, and that
Yes.
responsible party had to leave the store,
Yeah.
how might that have been handled in that situation, regardless of the sort of technology limitations?
Right. So in that situation, they probably would have ID'd the person because they would have had to like scan the identification before they like sold them the tobacco product, which is usually like standard procedure. Most of the locations, like even our daily customers, have their IDs ready, just because they know like what like we have to scan the IDs before they make a purchase.
Dan, Karen, Cherry, questions? Karen, please.
Yes.
So two follow-up questions. One, this is Karen Wazowski-Govan, sorry. Not used to that yet. So one, in terms of tobacco sales have been going on for a long time, long before technology existed. And people, whether it was 21 plus or 18 plus, had to not scan an ID, but had to actually physically check it. And we all know, working in technology world, technology goes down, as we all learned recently with the global outage, with all sorts of things. I guess my question and concern would be like, what practice is in place, should have been in place if said machine was not up yet? There should have been some type of practice in place to accommodate that. Or as such,
right,
when the
yeah,
global
usually,
outage happened,
right.
what would
Usually
have been
we
the
do
backup
have
plan?
we do usually have either Massachusetts or like in my other locations of Rhode Island, like we'll have a sign with like the updated birth date information, which like continues every single day. Like it changes in order to tell what age the person should be that day to get like to purchase tobacco products, or in some cases alcohol products. But usually there is some sort of like sign, like digital sign that changes daily to that you're supposed to uh confirm the ID with that sign to make sure that the age is correct.
All right. And then the other question I had has nothing to do with the sale to an underage person, but around the fact of knowingly selling tobacco when you knowingly didn't have your local permit yet.
Right. Yeah. So it sort of wasn't knowingly on our part. Well, it was knowingly and not knowingly, I guess. But it was just we had all the paperwork and stuff filled out. We just weren't able to come back and submit it because we usually have checklists and stuff for like every location that we take over. And we had gotten the business certificate. We had filled out the application for food and tobacco the same day as the business certificate. So somehow in that paperwork, we might have checked off that we acquired all three instead of having to go and submit that actual paperwork.
Karen, do you think if I just pose a follow-up question again? I'm sorry, I'm a little, this is Jen again, stuck on this technology piece. So when you hire a new employee, in many industries, as you said about filing forms, there's a checkoff list of what the person has to complete before they can do things independently and be left to their own devices. And so, yeah, I mean, I guess given the implications to a business and to minors, maybe something to consider in case somebody needs to step out of the building, leaving somebody, even if there is technology in place.
No, yeah, yes, I understand.
Sure. Sorry, Karen. I didn't know if you had anything else. And Dan, go ahead.
See, yeah, this is Dan Finn. Yeah, it's unfortunate. I think the whole sale piece could have been avoided if the employee put a sign on the door and said, making a bank run. We're not going to say that, just say, we'll be back in 5 minutes, because the person that took its place, he or she apparently was not even an employee, and certainly not a trained employee. And I don't want to get into the workers' comp thing, but having somebody run the store, the register, or whatever, that's not an employee, that's not insured, that's a whole different can of worms. I don't mean to bring up.
No, I understand. You're absolutely right on that, Dan. And we do apologize. And I think as you guys know that we've paid the actual fine. But yeah, we just like in order for us to continue like business, because like just 3 days of like not having tobacco can like affect our business much more than just like the actual fine. And I understand that is properly sometimes the proper punishment to give businesses whenever they do conduct themselves in ways where they don't follow rules and stuff. And I understand that certain violations do have to be taken seriously. But Oh, I'm sorry. There's more questions I can.
Yeah.
Yeah.
Karen,
Sorry. Go ahead. I'll
Karen
answer the
and-
questions.
Thank you. Karen and then Sherry.
Yes.
There we go. Karen Gozowski-Oven again. So I do want to clarify that, yes, it's nice that you paid the $1,000 fine, but do keep in mind that you had 2 state level violations literally happen at like the same time, which per the regulation means we could have technically fined you $2,000 and done a 7-day consecutive suspension because you had 2 violations at the state level within 36, not even remotely 36 months, which is what the regulation states. So technically, we didn't assess this most stringent penalty that we could have for the regulation.
Right. No, I do understand that. And yeah, we're definitely like thankful that it wasn't more of a fine, but um, just because this is a new business that we've taken over, and just because of this being the first violation at the location, that's why we just wanted to see if you guys could be more lenient. But I understand your concern about
2
how
violations.
2 violations. Yes, 2
at
violations.
the state level, which is much more severe.
Yes. No, I know. Yes, I understand.
Terry?
So, yeah, most questions I had were the same that Karen had, but I want to say that it is the employer's responsibility always, whatever happens in the store. And even if that person was a proxy for your employee, he should have been instructed at least not to be selling tobacco, because of the whole ID checking and not being trained. Even if making the other sales was important in that time. Also, like, again, why were you even selling tobacco when you did not have the paperwork in place? And all those, I don't know how many weeks you were open and you were already selling without a tobacco permit. So also, I want to add that the board cannot zero on the permit suspension. They have to give a minimum set of permit suspension that is at least 1 day if they choose to. Otherwise, the board had voted on June 13th, 2022, that Grafton sale to minor the permit suspension for the first time will be 3 days. So now it's all up to the board how and what they want to do at this point.
And I just want to confirm, I think we spoke about this when we initially spoke about what the fines and suspensions would be, but you all do have other businesses where you sell tobacco aside from these newly acquired locations, correct?
Yes, we do. Yeah.
Okay. Any other questions from the members of the board? Thank you, Cherry. Dan?
Yep, this is Dan Finn. Cherry, in your experience, have any other boards reduced a suspension to 2 days or 1 day for?
Not in our collaborative. It has not happened in Worcester or West Boylston. West Boylston does it differently. They do it case by case. That is what they voted on. But in Worcester, we have been giving 5 days. Nobody appealed the suspension. And Grafton, this was the first time that a sale happened.
And I don't know from our board here, this being my first meeting as chair, have we entertained a modification or a hearing like this before? How would we like to proceed with vote and roll call? I imagine we have to do that about making a decision.
Karen Gozowski-Oven. I don't recall, of course, it's been so many years and tobacco is few and far between, thankfully, that we've ever had someone have to come before us or request to come before us because of having a violation, let alone 2 state violations at the same time. So I don't think we've been in this type of situation before. And anytime we have had a rare tobacco violation for selling to a minor or anything else at the state level, I don't recall ever reducing what is kind of outlined, we'll say, in our regulations. And that's not even just tobacco. I mean, I'm talking in general, but we're focusing more on tobacco, but I'm saying in general for other types of permits and violations of permits.
I do believe we had somebody once want to come before the board and then they did not appear, if I recall correctly. So I'm assuming we need to make a motion on our decision and do discussion. Would anybody like to make a motion? Anyone of the board?
Madam Chair, may I make a suggestion, and I'm not, making a proposal, but I would suggest that maybe you take a vote first if you want to keep everything the way it is.
Thank you.
Right, take a vote on that, and then if people vote that down, then you can go to the adjustments. But I think right now, the first question I would ask, does the board feel everything should stay the same? And then you can vote and then move to the next part. Maybe that'll help.
Perfect. Thank you.
Move it forward.
I appreciate that. Thank you.
Yeah.
So at that recommendation, the current, as was stated, the fine has already been paid.
Yeah, excuse me, someone's gonna have to make a proposal.
Sure.
For that. Okay. Yeah, I can't.
Yeah. Oh, no, I know. So would anybody like to make a motion to hear whether or not we would like to keep the 3-day suspension for a roll call?
Can you hear me?
I can hear you, Bill.
Oh, there you go. I'm technically challenged here, but I'd make a motion that the penalty stay as it has been issued.
Okay. Any discussion? Roll call.
Has there been a second?
Oh, sorry. Second. Any seconds? I'm all out of sorts. Sorry.
I will second that motion.
Any discussion? Roll call.
Bill Muller, aye.
Karen Gosowski-Govan, aye.
Dan Finn, nay.
Jen Maynard, aye. So I think, we really appreciate that you all came to talk to us a little bit more about the details of, your piece of the things and the way they transpired. Terry did share a lot of those things with us initially, but we really appreciate that you wanted to engage with us. But as you've heard, the board has voted to keep the 3-day suspension. I do believe there was a recommendation or information in your letter how to go about.
Yes, there was.
Any questions for us?
No, that's it. Yeah, thank you for taking us into consideration. Thank you.
Absolutely. Thank you so much for coming.
I just wanted to add something that I will be reaching out to them and determining the dates for suspension, and I will let them know of the process.
Okay, yeah, no problem.
And Cherry, we don't have to impose the dates, do we? You can reach out to the.
No, yeah.
Okay. Thank you.
Thank you.
Great. Okay. First order of business is done. So how about our friends at the Alliance? Would you like to give us an update of all the other activities you've been doing?
Okay, Madam Chair, Amelia, would you begin?
Thank you.
Yes, thank you. Hi, Amelia Houghton. I will start with a communicable disease update. And let's start with flu cases. There weren't any that were reported, and the reports come through MAVEN, our epidemiological network system. And versus 0 this past month versus in June, there were a few. Moving on to COVID cases, we had 20 reported in July, and also we had same number reported in June. And we know with the wastewater data, the numbers are still rising. And they're, at this time of year, they peak around mid to late August. It's when students go back to school and, you know, there seems to be more activity, and then it recedes again. So we know that in terms of the COVID vaccines that are available, the updated one will come out in a few months. It's going to be later on in the fall. It's not ready just yet. And then staying with COVID, we have the employee COVID policy that the city will send out this week to reiterate the updates from this spring that MDPH adopted. Then we have, there isn't really anything to report from the outbreak scene. We didn't have any outbreaks, at least none that we knew of. And we didn't have any measles, anything that was in the news recently. Also with the senior center, Molly was there and she completed 14 blood pressure screenings for the month of July for the senior center, and the housing authority 2. And that's been the average for the housing authority. Also, the monthly health topic this month is foodborne illness, which was sent out as an Instagram post, and it can be resent if it wasn't received by Beth and Nancy and Devon to post. And also update, the city has now, most of Worcester County has now moved to moderate, from low to moderate for West Nile virus positive mosquitoes in light of the recent positive findings. We're still at low for triple E count for the town. But West Nile virus, we've moved to moderate. And again, we reiterate being very careful and using DEET-containing sprays, insect repellents, long clothing, just being very vigilant out there. And that's it in terms of communicable diseases. You know, there is some buzz around the bird flu. I think the CDC is up to, they're saying 13 cases, mainly in Colorado. So that's about it.
Thanks, Amelia.
For the communicable diseases.
Yeah, Madam Chair, if I can add one piece too, I was just charged this morning by Solo, which, you know, Amelia's just hearing this now. But it'll be Amelia, myself, and Dr. Hirsch putting together a more standard alert. So we won't be giving alerts like, you know, Southeast Massachusetts has a rise per se, but in the region. So you'll get this in a standard template that we'll send out. So you have an understanding what's going on. So we're putting that together currently.
Great, and I think folks can see the the spraying schedule is online, right? And they can call and ask for additional spraying if there's high mosquito activity, I believe. Is that correct still? I'm seeing heads nodding from what I read. It was a busy
Yes,
week for
when
mosquitoes,
they
that's
find
for sure.
positive samples,
Yeah.
Okay.
Yeah. And we always talk to the Tim McGlinchey, who's responsible for the spraying, and we do talk to him every time there's an alert with a positive mosquito from any of our catchment areas.
Yeah. Felt like the phone rang multiple times. You all get those alerts from TPH, and you're listening if it's your city or town or surrounding area. And this time we heard it. So, okay, thank you, Amelia, for that. Who's up next?
So why don't we go with Cherry and then Devon, because I know Devon seems to have a list of things. So Cherry.
Yeah, so these are updates from our other offices. Some of them are from our epidemiology team. They shared that the school superintendents and principals in Grafton have received final copies of their 2023 Regional Youth Health Survey reports. So they are available. The board at any time would like to have a presentation, a short presentation also, please let us know. And EP team, September is Emergency Preparedness Month, and our EP team is happy to drop off any educational materials for the and pamphlets off to the office for the public if the board is interested. And then this is the prevention effort, which is the Mass Call 3B grant, and this has been talked about in the previous board meetings. So just to give a preview of what this was, it's a prevention grant to delay the first use of tobacco, alcohol, and marijuana among youth. And in the last fiscal year, the behavior health team was working with this grant, and they were in their planning stages on what programs to bring in and how to spend down the budget. And right now, this fiscal year, the focus would be on implementation. Part of the planning stage, they were able to do trainings within the middle schools. So we used to sit, at least I used to sit, but the behavior health team continues to sit on the Grafton School Advisory Health Committee, where the parents, youth, any caregiver, principals, school adjustment counselors, teachers, educator, principals, they are in that committee. And then they were trained in positive community norms and also the HOPE training, which is healthy outcomes from positive childhood experiences. And out of that, the plan is to implement it, community-wide. And that's why they were identifying stakeholders who were going to be trained, and then they could take this further into the school and the community. And so right now, from the opioid subcommittee meeting, there was a request for doing Narcan training. Then also the police chief had requested Narcans, which I dropped off at the police station. I dropped off 24 boxes and cases of Narcan, and if there is more need, we always can drop off more. And I was also able to establish a contact with someone at Chris Corner, Milford. I believe it's Milford, to do the Narcan training. So I am in conversation with Marianne, who is the admin, I think, at the police station. So I'm working with her to establish some dates so that, we are able to provide in-person Narcan training to some of the municipal employees, whoever sign up. Yeah, that's it from me.
Great, thank you.
So sorry, I just forgot to add that the prevention team, they also asked that if the board is willing to hear more on the prevention efforts, they could do a presentation as well.
That would be interesting. Do you all think that would be good?
Yes.
Great. Sounds good, Jerry.
Okay, thank you.
So, Madam Chair, I don't know if you want Devon to go next. I don't want to hijack your agenda.
Devon can go next.
Okay, Devon.
Of course.
I'll go next. So, since our last meeting, I guess I'll start with complaints. We've had five complaints. And the complaints, they varied. We had a complaint about someone leaving out their containers in front of the property for an extended amount of time. The concerns were about the smell and the attraction of flies. I did a drive-by inspection of the actual complaint. I was unable to find out who the owners of the containers were. On my own, I just removed them closer to the property. And I'll continue to monitor those and also get in touch with the owner. The second complaint was there was a bed bug complaint at Crescent Manor assisted facility. I called and spoke with the facilities manager. There indeed was a bed bug outbreak, and it had to do with the fact that residents and family members weren't following the protocol when bringing in new items. Items are either being brought in from off the street, or residents were just bringing in items and they weren't going through the process of having them properly cleaned. And that's basically the issue. Items weren't being properly cleaned or dry cleaned. They were being brought in without permission. And the outbreak was getting out of hand. They now have it in control, and they're taking care of it.
Devon, just a quick question on that one. Sorry.
Yes.
It looks like the specific complaint had been the length of time it took to treat the facility.
Yes.
Were they able to indicate like when they identified it and how quickly they responded? It is a lengthy process to fully get rid of them, so sometimes people don't know that, but was it timely identified and then treated?
The issue with the time span had to do with the fact that once they treated, and this is one specific person complaining about their family member, once they were able to control one area, there was an outbreak in another area. So they had to maintain that particular area before they could get to their family member's area. That was the issue. They didn't understand that once you have a bed bug outbreak, you have to go above and below first in order to try to maintain it. Mm-hmm. But when you have people throughout not following protocol or visiting one another, so it kind of started a bit of a spread. I think that was the problem, but they tried their best to get a handle on it. Any more questions?
Thank you.
Oh, okay. We also got a complaint from an employee at Wyman Gordon's. There was an issue with the air quality in one of the tunnels. They said it might have been a mold smell. That's something that we don't address, so I had to turn that complaint over to the State Labor Department. We also had a complaint about a pool that wasn't being maintained. I went and did an inspection of the pool. It was covered, but not properly covered. The cover was hanging off. The family wasn't at home at the time. And Beth gave me a great idea that it probably would be a good idea to reach out to the Central Mass Mosquito Control Project. And they could probably help with educating and helping the family to getting it under control. So tomorrow I'll be in the process of taking care of that to get that that situation maintained. And the last complaint, which was last week, there was a complaint about rats. Apparently, an occupant observed a rat climbing on her sliding door screen. I went to the property to inspect, walked all around the property. I didn't see any burrowing or any nests for rats, but I observed a home behind the property that had a chicken coop. And this is also a wooded area. So I wasn't sure if it was possible that maybe the food for the chickens could have maybe have caused the rats to be in that particular location. In the front of the property, there were 2 bait traps. So that shows that there was some sort of activity already prior. So I'll be speaking to the property manager tomorrow to see if he received any complaints from the tenants of that particular property, and to see when the last time the traps abated. And if there's any conversation with the owners of the property behind that property. So that's it for all the complaints. There were 10 food inspections, 2 food permits, 2 solid waste haulers license, 3 repair permits, 3 septic inspections, and 1 well permit.
Dan, did you have a question?
I did, if you don't mind, Devon.
Sure.
Back to the complaints. You
Okay.
had a handful of nasty ones, or unfortunate, I should say. But back to the first one, 1 North Street.
Yes.
It seems to me that's not the first or even second complaint of that kind for that location. So I think it might be good if you could get in touch with I think tenants, not owners of that building, and speak with them personally. That the neighborhood is apparently upset with the trash situation, the handling of trash. Because I'm pretty sure we've seen that 2 or 3 times now.
Yes, actually, it was a complaint. It was one of my first complaints when I started, actually. It was.
Yeah. And but as opposed to sending a letter or doing it yourself, I think it'd be good to make an in-person contact with whoever is at that home,
Okay. I'll make it a
Just
point.
suggestion.
Okay, I'll do that, and that'll be an education. It'll be a more of an educational visit.
Right.
So I'll do that. Okay.
Exactly. Perfect. Thank you.
Okay.
Okay, Devon. Any other questions for Devon on that piece? Great. All right, I'm going to jump around a little bit to get through a couple of items, because then we can talk about fees. Anything else for COVID-19 related updates? I know Amelia gave us some updates. Anybody have anything to add? Okay. Anything on the opioid settlement funds? Dan or Bill or Ian?
Maybe I could speak. We're still having monthly meetings. We are awaiting a proposal from the chief of police for a small amount of funds to supplement something he's already doing in terms of program, and are still considering what other actions we should support.
Great. Thank you.
Yeah, and then Madam Chair, I just finished up cleaning the budget and putting in proportions to what town we have. So that's all complete. I think So and Cherry's just reviewing it, and then we'll submit that. And again, just so everyone knows, these are working documents, right? So don't feel like, this is it. Everything can be changed and adjusted and moving. So I think we'll resubmit that to the board again.
Great. Thank you. Dan, anything to add? Okay. Just to jump down briefly, because I don't think there's much on it. We do have a vacancy on the board. Are there any updates, Beth?
I asked the front office again and they were gonna repost it, but that was all. No one's applied.
All right. Tell your friends. Live in Grafton. Thank you. All right. And then Devon, do you have updated information for us on our body art apprentice friends? We had an outstanding question about whether or not they get paid during their apprenticeship before we touch their fee schedule.
Yes, I do.
Hey.
In Grafton, body art apprentices do not get paid. The client can decide if they want to pay the apprentice or not. They're not obligated to. In West Boylston, they're not paid, and in Worcester, they're not paid at the moment. Worcester right now is in the process of rewriting the code, and in the code, they're asking that apprentices are actually receive fair wage because they kind of do more work than they need to in the apprentice process. That's still in the process. But Worcester will eventually start charge. They don't even charge apprentice right now either, but they will eventually, once the code has been written, the goal is to charge, I think they plan on eventually charging apprentice $100. But at this moment, none of the towns, nor the city charges. Oh, and they're not paid.
Right. It looks like Millbury's the only one charging them at a rate of 100. At least from our schedule that we have here.
And that's and if they are paid, it's based on the agreement between the apprentice and the owner of the actual tattoo shop.
Yeah. And if they want to get, I mean, and is the piece that's up for discussion with the client like a tip if they want to tip them basically?
Yes.
Gotcha.
Yes.
So not anything guaranteed.
No.
Gotcha. All right. Thank you. Very helpful.
Welcome.
So that was the one area on the body art establishments that we did not vote on last time. So any discussion or about whether or not anybody wanted to add a fee or hold off at this point? Any discussion / motions?
This is Dan Fenny. I'd like to make a motion that we hold off on any fee for the apprentice, the body art apprentice at this time.
Any second?
No charge.
This is Bill Muller. I second that.
Great. Roll call.
Dan Fenny, aye.
Bill Muller, aye.
Karen Guzekowski-Govin, aye.
Ben Maynard, aye. Thank you. All right. And then we have a few more areas we're going to discuss fees tonight. Does everybody have their fee schedule, or will it be helpful if I share that data as I go through?
It'd be helpful if you shared it.
Oh yes, that's right. Thank you. You're dialing in for us, which we appreciate. Okay, yeah. Bear with me. Our first one is septage haulers. Okay, so this one, it looks like they do it per truck. And let's see, in Grafton currently is $125 per business. It looks like in surrounding towns we have, so that's per business for us. And for Millbury, there's 2 columns for Millbury, but one has 125. I'm assuming that's per truck. Another town is 150 per truck. That's Auburn. And then it's 200, 150, and 180 per truck. So we're at least $25 below, except for Millbury.
If the charge is per business, how does that compare to per truck?
That's a good question. Yes, you're right. Ours is per business and everybody else is per truck. least that's what it says on this sheet. Beth, is that correct? It's just per business here in Grafton?
Well, yeah, per business, not per truck.
Okay, so there's a couple of things. We're about $25 less than everybody else, but we're only charging per business rather than truck. So we could conceivably, Bill, to your point, I think, charge per truck versus per business and leave the fee alone, where that is going to be markedly higher, probably for businesses. I don't have a good sense of how many of these companies are in Grafton.
Are these for businesses that are based in Grafton or businesses that do business in Grafton?
That do business in Grafton.
That do business in Grafton.
Yeah.
I mean, I think it would be reasonable to charge per truck. It sounds like everyone else does that, and maybe leave the fee the same until next year when we'll increase the fee as well.
Yeah. And Beth, do you have a sense of how many companies we're talking about?
Let me see if, oh, I don't know if I can pull it up on this without losing you guys.
Bill knows us. We need you, especially.
I don't want to lose you.
We need our experts.
I think we're at about 17.
Okay.
Roughly, unless I'm confusing them with the solid waste. Right, we're doing septic. I think we're roughly about the same with both.
Gotcha.
17 trucks?
17 companies.
Businesses.
17 companies.
Companies, not trucks. And like, some of them have a few trucks.
I'm sure they do.
Yeah.
Yeah, and I can imagine there could be instances where, like, you have some companies that do less trucks, if we're going to talk trucks, less trucks going around town on an annual basis than some maybe bigger companies. It all depends on who's calling who to, haul.
Yeah.
So, although it might be 17 companies, you could have, I don't know, a third of them have a few trucks on an annual basis coming through town, and a third of them could be in the middle, and a third of them could be like, 50 plus trucks coming through town on an annual basis. I'm just totally hypothesizing, but just knowing it's kind of like foods and stuff. Like some have small food businesses and you have bigger businesses.
Yeah.
And what kind of notice again do we give them when we make a fee schedule change, or is this sort of when they come to reapply for their year?
We actually, I don't believe, sent out a notice on food or on farmers market.
So just when they come in and
yeah, we may have to this year though, if we're changing a lot of the fees.
Yeah.
Send out a notice before we ask them to reapply so that they're not in shock.
Right. I don't think we want to deter anybody from serving people in Grafton.
Yeah.
So this is Dan. If it's on an annual basis, I agree with Bill that we should go per truck, probably keep it at 125 per truck to reduce the shock value.
Yeah.
And
would you like to make a motion?
Sure. Sure. This is Dan. I'd like to make a motion to change the septic hauler fee per truck to 100 per truck versus per business, and keep the fee at $125 but per truck.
Second.
For the next year, annual year.
This is Bill Muller. I second that.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
Jen Maynard, aye. I will note there's other septic related things here, but I think we were sticking to the trucks today. I think. All right. Speaking of trucks,
we kind of went through and picked smaller things that we could go pretty easily through versus going like and attacking old food or something like that.
That's a good idea. So all right, so we did septic haulers, solid waste rubbish haulers. So there's two. There's the rubbish hauler, and then there's an additional truck fee. So the rubbish hauler is a $200 fee. It looks like Millbury is also 200. And Auburn just does it per truck. It doesn't look like they have hauler and per truck separate. That seems to be most of them that we have. Well, we don't have a fee actually for additional trucks. So it looks like we're doing this at the business level. So Auburn is doing it at the business level for a $200 base. Sorry, Millbury. Auburn is doing it $150 per truck. And then Millbury does an additional 100 per truck. We are doing 200 at the business level. Northbridge is 200 per 200 at the business level. 250 is Shrewsbury at the business level, and then the last one does it per truck. Sutton, which is 125. 120 per truck, sorry. This one's kind of all over the place. So we've got 2 doing it per truck. 2, 3, 4 doing just a flat fee, and one of those 4 also doing a per truck, if that's helpful.
Is it being inconsistent to have the seepage haulers charged differently than the trash haulers? I don't know.
I was thinking something. Aaron or Dan, any thoughts on that if we were to do similar? Go ahead, Dan.
This is Dan. I think we leave it the same. We're in the ballpark. And
Yeah.
I don't think we're on a mission to drive a lot of revenue here.
Right.
So I think we shouldn't mess with it. My opinion.
So you want to think about leaving this one?
Yes.
Okay. Would you like to make a motion? Somebody?
Sure. This is Dan. I'd like to make a motion to not change the rubbish hauler fee, annual fee per business. Leave it the same at 200.
Second.
Bill Muller, I second that.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
Karen Glusowski, Govan, aye.
Here I. Okay. Disposal workers, installers. Let's see. Where is that? There they are. Disposal workers. Disposal works installers license. Whew. Millbury's at 125. Auburn 175. Grafton 100. And then we have 150 Northbridge, 325 Shrewsbury, and 240 for Sutton. So closest ones, we're the lowest at 100. There's 125, 175, and 150. The others are quite a bit higher.
It's a very scientific process. I think 175.
Yeah.
Anybody want to make a motion?
I make a motion that we charge 175 for the haulers, right? No, the installers.
Correct. Disposal work.
Installers license.
Right.
I'll second that.
Roll call.
Bill Muller, aye.
Dan Finn, aye.
Karen Glusowski, Govan, aye.
Jen Maynard, aye. And that's 175 increase from 100 with our scientific method.
Yes.
Reasonable. We're looking to be reasonable. Let's see. Tobacco permit. Two more guys. We're almost there. And gals. Tobacco permit. So Millbury has two rates. They have 150 and 200. I'm not sure why. Auburn has 200. Grafton is at 150. And then it's Northbridge 200. Shrewsbury 150. Interesting. And Sutton 120. So we're above Sutton and on par with one of the Millbury columns.
This is Karen's question. What are the little asterisks next to, and the question for Beth, next to the dollar amounts for Northbridge, Shrewsbury, and Sutton?
Question.
I actually don't know.
My gut is it was just a typo, because I've done that before where I've typed something looking on the keyboard where the and then copied it over. Because it seems odd because it's just that little group of like 6 in a block of 6 right there. But I figured I wanted to ask.
I wonder if it was a signal from Beth's counterpart for us to consider one of these.
I know, that's what I was just thinking.
Because the same happens below with the funeral director. So if I had to guess, I think that the consideration would be the 120, 150, or 200, and we're already at 150, which again seems to be pretty on par with the other cities and towns. In fact, higher than at least one. So
this is Dan. I'd like to make a motion not to change the tobacco permit, to leave it at $150 per year.
This is Bill. I second that.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
Karen Gostowski, Govan, aye.
And Maynard, aye. All right. Getting good at this. Okay. We're almost there, guys. Funeral directors. We have Millbury's at 100. We're at 25. And then Northbridge and Shrewsbury are at 100, and Sutton is at 60. So we have the same little asterisks. So I'm assuming that there's some recommendation or wanting for us to consider to increase above $25, somewhere between 60 and 100 perhaps.
Well, using the scientific method, I would say 100.
That seems to line up well with the other cities and towns. Would anyone like to make a motion?
This is Bill Muller. I make a motion that the fee for funeral directors be increased to $100.
Second.
Dan Finn, I'll second that motion.
Thank you. Roll call.
Bill Muller, aye.
Dan Finn, aye.
Karen Gostowski, Govan, aye.
Maynard, aye. Okay. We're through all the big discussion ones. Now we have a bunch of minutes. I'm going to go ahead and hold off on the July 15th minutes. I know we have a couple of modifications that we're looking at, just tweaks to make. Sorry about that, Beth. But we have 3 sets of minutes from 2020. The first being January 6th, 2020. Is there any discussion, or would someone like to make a motion to accept those minutes as presented?
Did we see all the 2021? I think I saw the January 6th one. I'm just jumping ahead here. I don't remember.
I think she did.
I'm going back.
Karen, I think these are the few that we might have to make an exception and not really have a quorum to vote on.
Right.
I mean,
Well, you and I, Dan, you and I, I'm
Yeah.
sitting here talking, I'm like, am I off mute? You and I should be able to make a motion and a second on these, and then we can vote as like the rest, Bill and Jen can vote, but you and I were the only people left that were there, so we should be the ones making any motions and seconds at least.
Yeah. And we checked that.
That's what happened. If I remember correctly, that's what happened. We had one a while back.
Right. Where Austin wasn't on that meeting. It was just the two of you. Yeah.
I see the January 6th ones came through. Maybe there was one of them. I just don't remember if the other ones came through. Maybe it was a while back.
Do you want me to hold off on these for our next agenda?
Well, the January one we could
You want to do the January ones?
right.
Okay.
I'm not seeing the other 2020s, 2022s. I'm just scrolling through email now.
That being said, this is Dan Finn. I'd like to make a motion to accept the minutes of January 6th, 2020 of the Board of Health as presented.
This is Karen Guzevsky, and I will second that motion.
Roll call.
Dan Finn, aye.
Karen Guzevsky, Govan, aye.
Bill Muller, aye.
Well, you abstain. I think you abstained, Bill, right? Were you on it?
No, I wasn't on it.
So
I'm just, yeah, I guess I'll abstain.
I'll abstain, Jen Maynard. Okay, we'll hold off on April 6th and May 4th. We'll add those to our agenda for next month. And then we have May 2nd, 2022. Any discussion, or would anybody like to make a motion?
Same question. I'm trying to see if we have them. I don't see them. I don't see them having come through.
So many attachments lately. Okay, we'll hold off on those ones. So we'll have more minutes to talk about next time. And then a final detail here. The fee schedule changes that we've recommended today. Would anyone like to make a motion on the date that those changes should be adopted? I think we talked about these being annual fees. So, you know, I think we may have done it for the first of the year and the last one. So would anyone like to make a motion for effective rest of the following year? Or this coming the next year?
This is Bill Muller. I'll make a motion that we make these fee modifications effective January 1, 2025.
Second.
Dan Finn, I'll second that motion.
Do roll call.
Bill Muller, aye.
Dan Finn, aye.
Karen Guzevsky, Govan, aye.
And Maynard, aye. Thank you. All right, upcoming meetings. We are remote through the end of the year. September 9th, October 7th, November 4th, and December 2nd. And hard to believe we will be looking towards January 2025 before you know it. Anything else for old new business? Dan?
Now, this is Dan. I just want to remind everybody about National Night Out tomorrow evening. And Sherry, I think, I don't know if you're going to be able to make it, but someone from the Alliance is going to come by, correct?
I'll be there.
Oh,
Great.
good.
Yeah. Yeah.
So, great. That's
Yeah. One of my colleagues also would be joining us for the first 2 hours, but I'll be there throughout the event.
Great. I had my reminder right here, Dan, so thank you for that because I would have probably forgotten.
You have to relieve me.
That I won't forget that. I might forget to mention it on the meeting after all the fun we've had tonight.
Right.
Thank you for your patience in my first official with many agenda items tonight. But with that, I think we've spent enough time this evening together. Would anybody like to make a motion?
This is Bill Muller. I'll make a motion to adjourn.
Second.
This is Dan Finn. I'll second that motion.
Roll call.
Bill Muller, aye.
Dan Finn, aye.
Karen Gusetsky, Govan, aye.
Jen Maynard, aye. Thank you all very
Yeah.
much. Have a nice evening. Stay cool.